Prabjeet. Prabjeet,
Yes, Bob.
since you have posted on Instagram about crowns are not the only option, I'm getting so many DMs. If not crowns, then what? You have to take this up now.
Let's do it then. Come.
Hello everybody, welcome back to our channel. By now, you must have guessed today's topic, which is crowns are not the only option. I'm Dr. Harleen Sethi
I'm Dr. Prabjeet Singh Sethi.
from Dontia Dental Care to answer all your queries regarding dental crowns today. Keep watching till the end. Now, tell everybody what is the procedure of doing a crown.
Okay. So just like I said earlier, that crown is like a helmet. But there's one difference between the two. When we wear the helmet, our head becomes oversized. We can't do the same thing with our tooth. We won't be able to close our mouth. So to make that crown to fit over our tooth, we need to shave off the entire tooth. So basically, you are doing the thing first and then undoing it by giving a crown, right? You're cutting down the entire natural structure and giving back a crown to get back that structure. Okay? Why we do it is to protect the tooth. But over here we are forgetting that we are actually removing a whole lot of natural tooth, destroying the dome structure which God gave us in our tooth, because dome is a structure which bears all the loads equally and very well. And then again we undo it by putting a crown on top.
So that brings me to the question how to decide what to do when.
So there is one simple mantra for this. Jitna bacha sako bachao. So basically we need to save as much as natural tooth structure, and only the destroyed part of the structure should be replaced with all the filling like inlay, onlay, onlay, etc. So when the tooth structure is 50% or more remaining after your treatment, we definitely go for these treatments, in which if there's a small defect, we use inlays. Where there's a defect in which one of the cusp of your tooth is gone, we use onlays. Onlays cover the surface of the tooth, but not the entire surface. The entire surface, when we cover it, is known as a tabletop or a onlay, right? So in all these procedures, we are not damaging the entire dome-shaped structure of the tooth, because unlike crown, we are not shaving off or cutting off the entire tooth structure, just replacing the destroyed or the missing tooth structure.
So basically, the dentist here decides what to do when.
Exactly. It is the part of us dentists to decide what is best for you to save your natural tooth structure and also replace the missing or the destroyed structure.
So what are the advantages of these over a crown?
Okay, so to summarize, all these restorations, which I said in an alternative to the crown, they save a lot of natural tooth structure, and only the destroyed or the defective tooth part is replaced. And not to forget, there is one more advantage. These are done by a digital way, so their fit, the perfection is 100% accurate, and also the time needed is less than 24 hours to give this to you. So you just wait outside in the waiting room. Meanwhile, it's ready, you get it fixed, and the same day go back home with a new tooth and enjoy your smile and food.
Now tell me, what are the different materials these onlays, inlays are made up of?
So the material of choice for these restorations are a material which is almost matching the nature of our enamel, which is ceramic mostly. So ceramic is the material of choice, and these days even research is being made of hybrid ceramics.
So why not metal? Isn't that more strong?
Yes, this is a common question which even many patients ask us, and even some doctors ask. So tell me one thing, what is a helmet made up of? You know what the helmet does? A helmet protects our head, which is basically the skull, and in turn there's a soft brain inside, which is a vital part. So the function of the helmet is to save our head with the brain inside. Now tell me, what is the helmet made up of?
Helmet, metal?
It is made up of everything but not metal.
What?
Yes. A helmet is made up of polycarbonates, sponge and many other things, but not a metal. The reason being, whenever there is an impact or trauma in an accident, the polycarbonate and the sponge takes away all the stress and protects our head and the brain. So whenever there is an impact while chewing, the restorations which are made of ceramic, they absorb entire trauma and the pressure, and they might break, but they will not let your tooth break.
Wow, such a nice thing. This will make the life of the tooth stronger or longer.
Exactly. And this is what I said in my last post, that I give guarantee for your tooth, but not for the crown. Okay. You definitely don't want your crown to last and your natural tooth to break.
Interesting. So we come to the conclusion now that crowns are not the only option.
Right.
But then, do we never do a crown?
So, out of 10 cases, there are 9 cases in which we do not do crowns. But sometimes, like I said, when the tooth is less than 50% destroyed, we go for inlays, onlays, etc. And when the tooth structure is more than 50% gone, then we have to do a crown when no options are left. So that is the last resort,
One last question. I think my audience would want to know this. If there is a gap in the front tooth, do we do onlays, inlays in the front teeth also?
No. So this is altogether a different thing. There are many solutions to this, and I think let's keep it for the next session because that's too much for today. Let them digest that crowns are not the only options. There are many more.
So keep watching this channel for the next topic, which is closing the gaps with and without braces. Till then, ask in your comments whatever your queries are. Don't forget to like, subscribe and comment.
So Alim, let the crown be a crown only. There's no place for it in your teeth.
Thank you.